Hi pals, it's me Artie, then in pronouns only, and my video this week is one that I have been thinking about for a while. I have a fibromyalgia diagnosis among a long list of other chronic health issues that have now been diagnosed since I was diagnosed with fibromyalgia in 2016, I think. So it's also nearly been 10 years since I had that diagnosis. We've had some time for medicine to move forward. We've had some time for symptoms to appear and disappear and what the fuck ever else. Like most people, including doctors, really kind of agree that fibromyalgia as a diagnosis is like IBS or FND, where it's like you have a bunch of symptoms and we either just don't know what the fuck is causing them or we can't be bothered. So here's this label for you, except I don't know quite as much about FND, and IBS is generally quite a vague term for got shitting problems in it. However, fibromyalgia also has 200 symptoms. And like, quick disclaimer, I'm not saying definitively that fibromyalgia doesn't exist. I'm not saying that people who are diagnosed with fibromyalgia have nothing wrong with them. Like, I am you. I have been you. There is something going on and I believe you. I'm not saying that getting a fibromyalgia diagnosis isn't helpful for some people. It was helpful for me in my earlier years of fucked up health issues, because it was the only way I was going to receive any kind of treatment for my pain. Nothing else I had diagnosed at the time had anything else to offer treatment wise besides physio. So the video I wanted to do is go through these 200 symptoms and point out which ones I think it's just easier if I just start going with it, you know? I just start the video. Get my water, because I have a feeling I'll be talking a while. Here's something I made earlier. I looked for a decent article, okay? I looked for a decent article about this, and I do want to quickly shout out the article that just had the funniest name to do with this, but I ended up going with a different article. So yeah, I'm using the More Good Days list just because their lists was like a bit easier to follow. This other article, it was like several things, sometimes per bullet point, that were like completely unrelated. So this one was broken down into different body categories. When it comes to generally what is known as / what the NHS knows fibromyalgia as is increased sensitivity to pain, that usually also comes with like 4 main categories of symptoms, and it's a lot vaguer on the NHS website. So one of the lists I could find that I assume is around 200 symptoms, I'm not going to count. I already went through and crossed off a bunch of things that I know are not, like, I've never had those symptoms, or I don't have those symptoms. One of the first ones was an irregular heartbeat. Another one was carpal tunnel. I don't have that, but I can see myself going that way. Seizures, stroke-like symptoms, and literal mini strokes. Since when were either of those things fucking fibromyalgia? This list is ridiculous. Tinnitus, don't have that. Conjunctivitis, one I can't pronounce, a bunch of eye inflammations that I can't pronounce. There's like 4 of them on there. Like, the other thing I noticed with these lists was like, oh, it will start with something like, oh, increased risk of viral illness or whatever, and then it lists a bunch of different viral illnesses as symptoms of fibromyalgia, which doesn't make any sense. Who did that? Who did? How is conjunctivitis a symptom of fibromyalgia? Shut up. And things like cataracts and glaucoma, these are not symptoms of. Also, macular degeneration, retinal detachment, vision loss. When we get there, eventually you'll find that most of these symptoms are neurodivergence of some kind, ADHD or autism mostly, and fucking EDS. Mouth ulcers and hearing loss. Don't have those. I crossed off IBS. Also, hypoglycemia and hyperglycemia, nutritional deficiencies, vitamin D deficiency. See, that's what I mean. What's the fucking point? What's the point? Gastritis and hemorrhoids, all are ones I have not had. Bladder spasms, something cystitis. A bunch of these I don't recognize. So I was like, well, I probably haven't had that then. So swelling and bloating, whatever that means. What does swelling and bloating mean? Because this is in urology symptoms. So I've never had bloating from anything to do with pissing. So yeah, there's a bunch on here that I literally can't even pronounce. Peptic ulcers, gallbladder dysfunction, pancreatitis, kidney stones, bladder dysfunction, prostatitis, endometrial hyperplasia, PMS, painful periods, pelvic pain, endometriosis. That's not a symptom of. That's a fucking condition in its own right. What do you mean? Hormonal imbalances. I didn't cross off adrenal fatigue because it's basically a bullshit term. It's a health and wellness term. It's not really something that's used in medicine, but is basically just saying, again, hormonal imbalances for the most part, because your adrenal glands are linked to like the cortisol and shit. Erectile dysfunction, I do not have that. And infertility I crossed off because I don't know, man. Swollen lymph nodes, recurrent bronchitis, pneumonia, swollen glands, esophageal spasms, hypersensitivity, pneumonitis. Not a clue. Spider veins, varicose veins, skin infections, burning sensations, something dermatitis, skin ulcers, pressure sores, hypopigmentation, acne, edema, lymphedema. Nail ridges also don't have. Hallucinations, delirium, derealization, obsessive compulsive tendencies, paranoia, sleep paralysis. Oh, itchy nose. That's not a symptom of fibromyalgia. Hot flashes, taste disturbances. Would you like to know what that one's likely to be? COVID. That one's probably long COVID, actually. You got ME thanks to COVID. Reduced sensitivity of the senses. Yeah, so that's my list of I don't have those. So now going on to the list of symptoms I do have or have experienced and what they are instead of fibromyalgia. Now I've got a long list of other health conditions that have been diagnosed. Chest pains and heart palpitations. Like, we still haven't gotten to the bottom of this one, but even though I don't know if I necessarily have POTS anymore, or if I ever did have POTS, I definitely have a dysautonomia. My autonomic system is just not doing its job, you know? High blood pressure, low blood pressure, because I am currently... my blood pressure has been in that, like, stage 1 high blood pressure stage for so long, like, mostly because I have been on steroids for a long time, right? So I was like, you know, I'm now quite low on steroids. I have always had to take my blood pressure for my ADHD meds, for blah, blah, blah. And it's always quite high. So I booked an appointment with a GP for my blood pressure because I was like, I think it's time to just like do something about my kind of high blood pressure before it keeps getting higher. Maybe that's why I get migraines as often as I do. And now as soon as I start doing my blood pressure twice a day, morning and evening, so I have some recent information to provide the GP when I go, it is all over the fucking place. So my blood pressure is usually around 130 over 80 to 90. It's usually somewhere around there. The lower number is the more concerning number, really. And now it has just been much lower. Some of the days the lower number has been low, but sometimes the lower number has still been high. It's still been all over the place. So I just put both. I used to have quite low blood pressure. People used to comment on it all the time. And now I'm in sort of the high blood pressure range, either because of genetics, because my mum has had high blood pressure since her mid-20s-ish, or steroids, or kind of a weird combination of the two. Also could be dysautonomia, dizziness upon standing, again, the dysautonomia I'm being assessed for, but also I think that's just generally quite common among hypermobile people because of blood pooling. Postnasal drip. I now have at least one diagnosis of like having an allergy to dust mites, which is like one of the things it causes is postnasal drip. It's really irritating. Recurrent infections. I am on 3 immune suppressing medications. They just make it more likely to get infections anyway. To be fair, I have definitely been quite lucky with this and not really gotten so many infections, but at times, not great. Slow healing, EDS. Susceptibility to colds and flu. I think I've not had a great immune system for most of my life anyway, as I've talked about in other videos. I used to catch literally everything fucking going my entire childhood. The first time I was ill, I was 8 weeks old. I have paperwork that says that. So I think I've had a compromised immune system for a long time because of recurrent infections like that. And a lot of the times getting ill does not actually improve your immune system. It damages it, especially now with COVID and certain other ones as well. I can't be asked to go into that right now. Pain symptoms, widespread pain, EDS, morning stiffness, still EDS, muscle twitching. I don't exactly know what that is. There's a few factors in muscle twitching a lot of the time, so it could still be a number of things. One of them is still EDS, and another one I think can be linked to exercise and also a link to certain vitamin deficiencies, etc. You know, you're supposed to like magnesium's supposed to help, that sort of thing. Muscle knots, cramping and weakness. So muscle knots is definitely my EDS and really struggling with having a body and using it correctly. Cramping, again, I think is usually associated with exercise, tight muscles, and like lacking in certain nutrients. So the same sort of thing like magnesium. Again, still very common in EDS. Also weakness, common in EDS, but also a lot of these things I get as well in my right arm in particular because of my Takayasus. Reduced tolerance for exercise. Well, considering I have been repeatedly ill since I was born and have chronic pain and also have a type of urticaria that is triggered by getting too hot and getting sweaty, reduced tolerance for exercise comes in many forms. Exercise-induced pain, yeah, because my body hurts all the time because it does not function properly. Post-exertional malaise, yep, again, really common with EDS, and I've mentioned a few times, I think it's possible I maybe have like a mild ME, but trying to deal with that, no, don't have the will. Muscle stiffness, I swear, yeah, morning stiffness, but now this time it's muscle stiffness. Same thing as I've just been saying, EDS. Tendinitis, plantar fasciitis. I don't know what heel spurs are. Bursitis. These are all just different kinds of inflammatory kind of injuries, basically. I'm more like predisposed to having things like that because I've got numerous autoimmune conditions. So if my body inflammation is up, I'm more likely to get those things. And also, you're more likely to get those kinds of injuries anyway with EDS. Neurological symptoms, vertigo and dizziness. Mine is definitely much more mild than my mum's, but yeah, I'm very sensitive to that. I'm very sensitive to motion and movement. A lot of the time, I do have to face the direction I'm going, regardless of what travel I'm taking. Headaches, again, we haven't really looked into this fully, but I definitely think there is a large connection to my EDS as well. Also, positional migraines I get quite regularly, which I think again is quite common with EDS anyway, especially if you've got super flexible and unstable maybe like neck joints. Syncope, fainting. I even though I have never fainted pre-syncope, dysautonomia, restless leg syndrome, which I don't think I really fully understand what that is or what it's like, because people say it's painful, and I've never felt like it was painful trying to sit still, but I do have ADHD. And also I think again it's common in EDS to move often, because sitting or standing in one position for a long time is often where a lot of the pain and stiffness kind of comes in. Tingling and numbness, again, yes, I don't have great circulation. I often get tingling and numbness in my hands and feet, mostly depending on like how I sit, how I'm laying down, or like holding things. Like laying down in bed on my phone, hands dead. Sitting here like this, feet dead at some point. Perception symptoms, whatever that means. Cognitive difficulties. Shall we look at the list, lads? ADHD, autism, dyslexia. I'm also going to put auditory processing disorder in there as well, because wow. But also then just the general fatigue that comes with having all the other conditions I've got. Memory problems, again, ADHD. Difficulty concentrating, ADHD. Disorientation, really common with ADHD and autism. It can be hard to navigate around places, even places you go to often. Feeling of being overwhelmed, ADHD, autism, brain fog. Again, all those things I listed, all of the conditions I have can cause fatigue and brain fog, really. Speech problems. You can have speech problems with both autism and ADHD for different reasons, but also you can get them specifically with EDS. I find I can slur my words because I just like can't move my face. Like I can't move my face properly, and especially when I'm like tired, I find it harder to enunciate properly. So again, EDS as well. Balance issues. EDS, ADHD, autism, and dyslexia, blah, blah, blah. Although all of those things also are most likely because of the EDS that most people with ADHD and autism have. And again, coordination problems. Same as eye, ear, and mouth symptoms. Dry eyes and mouth. Dry eyes, allergy related usually. Dry mouth, usually medication. My medical cannabis makes my mouth so dry. But I've also got some other medications that also make my mouth really dry, that sometimes I'm like, wow, I don't feel high at all, but my mouth is giving me that horrible dry mouth feeling that you get from being really high. Vision changes. I mean, again, medication. My eyesight has changed quite drastically since being on steroids. Vision changes, as well as like I have a very mild astigmatism, which makes looking at things in the world in the dark suck, honestly. Also, I've realized how much my eyes and my brain really hate trying to read train announcement boards with like the black background and like the bright orangey text. It's really hard to read. Puffy eyes. I thought everybody just got puffy eyes. after being asleep, after crying. I don't know. So either I just don't have this symptom, or this is just people's like. Also allergies. There we go. Allergies as well sometimes. Dark circle under eyes. A lot of my health conditions come with the symptom of I don't know whether it's just pallor, or like pale pallor, but basically my conditions come with this bitch looks ill face disease symptom. Also, a lot of my medications mean they make me look more pale, as well as I have to be more careful in the sun. Also, again, I'm going to say it again, EDS. Like our skin is different, and a lot of people often have like dark circles. And to be fair, mine are not that bad from far away. It's when you sort of like are up close, you're like, oh, you okay? Eye twitching. I'm going to just like refer back to the other muscle twitching because same difference. Teeth grinding, again, EDS and ADHD, very common. TMJ, EDS, dental problems. Oh my god, okay. EDS, chemo drugs, steroids, Crohn's disease. If you don't take care of your mouth hygiene very well, you can get really bad abscesses, which can fuck up your teeth, but also malnutrition from it can obviously impact your teeth. There's a few other things as well. I can't remember what else. Oh, also like EDS, it's really common to have receding gums, which I have. Gum disease. I think, do I technically have gum disease? I don't remember if I technically have gum disease or it's just receding gums, or if like I'm maybe on the way to gum disease if we're not careful. I don't know. Either way, EDS, really common. All those things I just said, common. Tooth decay, again, same thing as I just said, because those all come under dental problems. Who made this list? Emotional symptoms: anxiety, depression, mood swings, irritability, panic attacks, personality changes, emotional sensitivity, stress intolerance. I already am diagnosed with anxiety and depression anyway. ADHD and autism come with mood swings quite often. They also come with emotional sensitivity or rejection sensitive dysphoria, personality changes. I have a personality disorder, guys. I don't know like how to break this to you. I don't know how to break this to you, but I've got wonky personality syndrome. Sorry, I actually am always like this 24/7 actually. I mean, you can see my moods and personalities in my videos be different, you know. Stress intolerance, again, really common with anybody with trauma, ADHD, autism, etc. But also, funnily enough, I'm going to throw in allergies. I am pretty sure I'm allergic to stress, so there we go. That's the emotional symptoms. Gastrointestinal symptoms. So excited to say Crohn's disease for all of these. Again, digestive disorders. And I told you I already crossed off IBS. What's the point of having these as separate bullet points on the list? Abdominal pain, bloating, constipation, diarrhea, nausea, acid reflux, all Crohn's. Weight changes, also this pisses me off. Weight changes, weight gain, weight loss. Just put weight changes or weight gain / loss. You know, just put one of those. You don't need 3 bullet points. So yeah, again, Crohn's disease anyway. Medications I've been on. I guess that's technically it. Appetite changes, again, everything else I've just been saying. Cravings for carbohydrates and sugar, really common for ADHDers, and also autism. Anemia. I did become anemic once early in my Crohn's diagnosis, mildly, but fucking hell, it was exhausting. So that was Crohn's because I was not, I can't remember what the word is now. What's it called? Digesting, processing, whatever. Doesn't matter. You know what I mean? Oh, I missed one. Insulin resistance, which again, it is a term used in the medical field a bit more because they've realized it's not as straightforward as just diabetes related or just diabetes or just blood sugar related. So I think I probably have insulin resistance because of steroids, mainly. Heartburn, again. Crohn's disease, also very common in EDS2. Urogenital symptoms. What does that mean? What are those? Frequent urination. I drink a lot of water, and I'm not particularly well hydrated, even though I drink a lot of water. So I think that's something, maybe a combination with Crohn's and a dysautonomia thing. There was something I read recently, but I can't remember what it was off the top of my head. Liver enzyme elevations. I've had a few of those. Again, a lot of the times it's been medication, dose changes that don't sit well, but it also can be anything from literally being ill with a virus to like basically any, like it can be COVID. It can be COVID. COVID can elevate your liver enzymes in your blood tests. So hormonal symptoms, menstrual problems. I've been on the pill for a long time, so I don't have periods anymore. Haven't had them for a long time, but the reason I went on those is because I didn't have a regular cycle, and it could often be very heavy, and it would change how long the period was. So I would say yes, menstrual problems. And then also it starts listing menstrual problems, including heavy bleeding and stuff like that. So that's one of the low libido. I have literally just never really had one. If you're new here or like aren't interested in Heartbreak High, I'm asexual. So I've been asexual for a while, Respiratory symptoms, dry or burning throat. I think again, partially medication, also possibly linked to allergies, because allergies can dry out your nose, your throat, etc. Breathing difficulties. Again, I possibly have allergy related asthma. I had pleurisy at one point, so my breathing can be a bit weird. Voice changes. Didn't really know what that was supposed to mean. There's no examples, but my voice often becomes hoarse for no reason. Also, hypermobility, EDS, like you can do more things with your voice. I don't know. Laryngitis, again, that's just like a viral or bacterial infection. But I used to get it a lot, but like I wouldn't say that's a symptom of something, of another condition. Chronic sinusitis. God, why is that so hard to read? Again, I have allergies. Asthma exacerbations. Again, I have allergy. Sore throat. I have allergies, but also sore throats are common with Crohn's disease and EDS as well. Shortness of breath. We've already gone through that. Acid reflux. Crohn's disease, also common in EDS too, because we've got some weird things going on with our gastro stuff and everything's too bendy and things go weird. And here we go, pleurisy. That's inflammation of the lining of the lungs. I had pleurisy in my left lung in 2019. So since then, there have been some weird changes to my breathing in certain weather. Again, that's not a symptom. That's not a symptom of fibromyalgia. Like, I think this whole like, oh, there's 200 symptoms of fibromyalgia is just a bit daft, because I feel like this list should be symptoms of, and then also comorbidities, maybe, because like most of these symptoms are just other conditions. And if anything, it's like, well, if these are comorbidities of fibromyalgia, then why are you still like really fighting for fibromyalgia to be a diagnosis that exists, when most of these other conditions basically explain all of the fibro symptoms? Skin symptoms, and again, I have allergies. So if these aren't all just my allergies, or EDS, to be fair, skin sensitivities in general. Then it says rashes, itching, yes, allergies, bruising easily, EDS, but also a lot of medications I'm on. Mottled skin, common with EDS. That's the blood pooling kind of thing in your legs. Raynaud's phenomenon. I don't have like actual Raynaud's, but I do have like pretty terrible circulation in my hands and my feet. It's a super common comorbidity with hypermobility syndrome or like other like EDSs. Also, Takayasus, I don't have blood flow in one of my hands. Pins and needles, again, they come and go, they happen, but like they have their causes. Like I know what they are. Electric shock sensations. I sometimes get this in my limbs when like one of my joints feels a bit stuck and I'm trying to like, or I move my arm or my leg in like a particular way really fast and I suddenly get like a jolting pain through my limb. I think that's just literally EDS. The nerve is getting like caught in places it shouldn't be. Scalp tenderness. This is one that I don't have a cause for besides my migraines. So like eczema, I had it when I was a kid. I don't have eczema anymore, but I do have very dry skin. Psoriasis, I get psoriasis when I'm on high doses of steroids, which is kind of the opposite of what's supposed to happen, but it's always caused by my steroids. And again, hives, urticaria. I have allergies.
I have allergies.
Scar tissue pain. I think that's literally common in most people, that where you have scar tissue can often still have pain, whether that's like a psychosomatic thing that, you know, kind of like how the whole body keeps the score vibes of like when it comes around to that same maybe a year after an event happened and you feel that those same symptoms or the same pain or whatever. Like I've had that many times even though nothing's been wrong. Or I also just think the nerves are probably just like a little bit fucked and confused in places where there's scar tissue, and you're more likely to have fucked up scar tissue with EDS anyway. And then again, keloid scarring, which is common in EDS. Hyperpigmentation, I kind of have a little bit around my neck and like where my bra sort of goes and things like that. But I don't know whether I would necessarily call that actual hyperpigmentation. And I think that can really commonly come with like the long-term steroid use, hypermobility syndrome, just being fat, just being a big person, being a bigger bodied person in the world, because most clothes just don't really fit that comfortably, and I feel like that has its impact. And then stretch marks is on here too. They are super common in EDS and also just super common in general. Like lots of people get stretch marks as teenagers and as children from like growing really fast. But yeah, it's really common in hypermobile people because our like skin is, like I've said a million times, our skin is just different. Rosacea, face flushing, again, I think that's mostly my allergies, but maybe there's something else going on. I haven't had my allergy testing like fully done yet. I haven't seen a dermatologist again since my first appointment, so in progress. Hair loss, medication mostly, but also common in Crohn's with malabsorption of nutrients, common in Takayasus, common in whatever else is wrong with me. Also really common in an underactive thyroid, which I also have. Brittle nails, common in the underactive thyroid as well. I think also common in EDS. Nail discoloration. I can't remember what I was going to say about that one. I'm not going to lie. And then again, more cognitive symptoms. I feel like we just didn't we have this list already? But no, there's another. Don't worry, there is another list. Cognitive dysfunction, and again, brain fog is on here. Again, impaired judgment, difficulty making decisions, difficulty planning or organizing, difficulty with multitasking, disorientation, that was on there as well, confusion. All of those are really common in autism, ADHD, dyslexia, auditory processing disorder. Depersonalization, feeling detached from oneself, again, quite common in autism actually. And also like quite a common, the word is literally on the tip of my tongue and I can't think what it is. It's a really common thing for your brain to start doing when you are in chronic pain. Let's just word it that way. Like the reason why I really hate things like mindfulness are it brings too much attention and awareness to how much pain I'm in. So I am often feeling detached from myself, you know? Phobias. Just got phobias on here. It later then also specifically lists agoraphobia. What is the point? If you're going to put phobias and then put one specific, just put the one specific phobia, but okay. But again, agoraphobia is really common in anybody chronically ill. But also autism, really common in autism. Thoughts of unaliving yourself and self-harm tendencies. Again, just a common thing for people's brains to do when you're chronically ill, neurodivergent, traumatized, having BPD as well. And also, I think a lot of my own self-harm tendencies were actually more to do with like well, I think partially it was a self-harm thing too, but also a large aspect of it was self-soothing stimming in an autistic way and social anxiety. I get social anxiety because I'm autistic and have audio processing disorder, and also I'm really struggling being off of my ADHD meds, trying to do anything on time and getting places without completely fucking everything up in the process. Generalized anxiety disorder, I don't have that as a diagnosis, I just have anxiety. So, and again, depression's on here again. Sleep and energy symptoms, fatigue, again, all of my health issues cause fatigue. Sleep disturbances, I have a lot of pain insomnia. I wake up a lot in the night. I find it hard to get comfortable. I find it hard to stay asleep. Sleep apnea, very common in autistic people and EDS, something to do with how your facial structure just is how it is. I've been referred to the sleep clinic, so maybe we'll find out if I have sleep apnea, because it is quite likely with just having autism and EDS, honestly. Insomnia, I have bouts of insomnia, sometimes longer periods, sometimes shorter ones. Hypersomnia, excessive sleepiness. I definitely don't sleep a lot, but I do feel excessively sleepy for like periods of time. Like I said, sleep disturbances is on here, non-restorative sleep, nightmares. All of these are like just common with literally everything I've got going on. General sensitivities. Sensitivity to cold or heat, autism, allergies, sensitivity to odors or odor intolerance, autism, photophobia, sensitivity to light, autism, phonophobia, sensitivity to sound, autism, temperature regulation problems, dysautonomia, autism, my ADHD meds when I was on them, night sweats, my autoimmune disorders when I'm very unwell, allergies. I just have allergies. Chemical sensitivities. Common in EDS. Sensory overload. I have autism and ADHD. Hyperesthesia, increased sensitivity of the senses. I have autism. I am autistic. And that was the list. So yeah, that was the list of, I suppose, 200 symptoms, even though most of them were just bullshit or their own conditions. So yeah, like I said at the start, I'm not saying the diagnosis isn't helpful to some people. I'm not saying necessarily that it is a completely bullshit diagnosis, but it is definitely 90% of the time doctor laziness or doctor inability to spot certain diagnoses, you know, not being educated enough in areas they should be. And a lot of the times, especially in more recent years for me, I have found that having a fibromyalgia diagnosis is actually disruptive to me receiving medical care, because they won't give me lots of things because I have fibromyalgia, and it might flare up my fibromyalgia and all that shit. And I'm like, what are you talking about? Shut the fuck up. And I just wanted to go through this supposed list of symptoms to talk about, like, actually, hey, look, basically all of these symptoms that are associated with fibromyalgia, I now have actual diagnoses for, like, majority of them, or I'm in the process of getting those answers. So for people out there who maybe got a fibromyalgia diagnosis early and now their doctors won't really do anything, I urge you to try and do some research into your symptoms. Keep diaries, symptom diaries, ask for tests, speak to your doctors, see a different doctor if you can, and try to get to the bottom of the other conditions you probably actually have as well. Because I know that if it wasn't for me pushing for some of these diagnoses, including my Crohn's disease and Takayasu's, I would be dead. I would straight up be dead. And I say this regularly on this channel, that if I didn't push for investigations and referrals and tests to be done, I would probably be dead, because my autoimmune diseases, especially like Crohn's and Takayasu's, have not been kind, and they have been hard to get under control. Like, I'm on year 5 of being diagnosed with Takayasu's very soon, and it's only kind of just started to chill out a bit. And even then, I've had to up my dose of my chemotherapy medication as a thioprin, because my inflammation is starting to creep up since December before I can carry on trying to taper off of my steroids. So, like, I say this with love. Please advocate for yourself if you have currently just got a diagnosis of fibro, and maybe like one or two other things, because most of the time I think doctors are just not interested or just not able to, because they're so busy, and the NHS is fucked in it, not able to commit the time they should to their patients and to continuing their learning, that a lot of the time chronically ill people in particular end up with the short end of the stick. And there are so many things that could happen with the kinds of conditions that have these symptoms. As I've said before, and I said in my introduction to Takayasu's video, a lot of people I have met since being diagnosed with Takayasu's weren't diagnosed until after a life-threatening event. And you don't want that. You don't want that to happen. You don't want to go through that. It's we're better off preventing those things as much as possible, but it is hard to get someone to listen to you. And there are so many other reasons why they might not listen to you, to do with their own biases, your weight, your gender, your sexuality, your skin color, even your religion, and how you dress can all impact how doctors, nurses, etc. see you and whether they believe you or not. So whilst this video was also made lightheartedly to just kind of laugh at some of these 200 symptoms for fibromyalgia, it is also a little bit of a PSA of like, hey, if you have fibromyalgia, you should watch this video and you should push for someone to listen to you, or like anybody who supports you, get them to push on your behalf, because it's not okay. It's not chill. It's fucked. And we just get left like this for long periods of time. I mean, it's like, how many viral stories have we seen of women being brushed off and they have literal fucking cancer that could have been diagnosed super quickly and easily, but now they're in like stage 4. And it's just like, oh, okay, this is my life now. Okay. Like, being diagnosed with anything is an adjustment, but as well, most people with chronic illnesses, I feel like, agree that at least getting an accurate name for what's going on, or at least part of what's going on, can be a relief as well. You can decide whether you want to educate yourself more on that condition or not. You can just feel more confident in the fact that you have a legitimate diagnosis, legitimate reason for why you feel the way you feel, and now maybe doctors will be a bit more wary. We hope. We think. We hope, with positive affirmations. So yeah. Anyway, that's my video for this week. Don't forget to like, comment, subscribe. I mean, I have lots of videos you could go and watch about my health conditions and my journey. So I mean, a fun one you can go and watch, which is highly unlikely for you to have, highly unlikely for you to have, is my Takayasu's video. So go and learn about a rare autoimmune condition called Takayasu's, like some of the symptoms, some of the diagnostics, etc., etc. Go and watch that and support my channel. And yeah, that's it from me this week, and I will see you next week. Bye.